Hello guys, welcome to my YouTube channel. Today we want to talk about community health promoters. These are CHPs. They used to be called community health volunteers, but nowadays they're being called community health promoters. This is a guide that I'm going to give you on how community health promoters and mobilizers are going to work when they are going to the community, when they are visiting the households, or when they are doing any activity. So first we have to understand that this guide, how are you going to use it as a community health promoter? So if you are going to educate somebody somewhere, you're going to educate him using this, him or her using this guide that I'm going to give you. First, this job about community health promoter, this is an aid, is designed to assist you as a community health promoter as you move from house to house in the community. The guide has important facts that you will refer during household visitation. You will be expected to find out if people living in the household are up to date with their vaccinations from mother and child handbook. The Ministry of Health plans to introduce new vaccines to the immunization schedule as an effective way of reducing the burden of vaccine preventable diseases as recommended and approved by the World Health Organization. Another thing that we're going to do here is we're going to learn about immunization program in Kenya. It was established in the year 1980s, that is 1980, yeah, when the main aim of providing immunization against six childhood diseases, namely tuberculosis, polio, diphtheria, whooping cough, tetanus, and measles, to all children in the first year of life, as well as tetanus toxoid vaccination to all pregnant women. The program continued introducing more vaccines to further protect people from more vaccination preventable diseases. Currently, it offers vaccination against 12 diseases. These are referral to schedule. You will refer to the schedule that I will give you later. And other emergency vaccines like anti-rabies or anti-snake venom, free of charge. So anti-rabies and anti-snake venom is free of charge. And immunization is one of the key health indicators for universal health coverage, UHC. Despite achievement made by the immunization program so far, challenges still exist that include low immunization coverage. Not every person who qualifies for immunization is reached. And high dropout rates. People start, but they don't finish immunization, like defaulters. High number of unvaccinated persons who have not been vaccinated, that the rate is very high. So those are some of the challenges that these community health promoters will be finding in the community. And community health promoters or mobilizers are part of an important network across Kenya, working to provide health education and services to families who may not otherwise have access to care. And community health promoters have been vital in creating demand for health service like immunization service at the community level, as well as linking families to the immunization services. So let's know about creating good relationship with caregivers. We call them caregivers or the gather. As a community health promoter or mobilizer, you should always establish and maintain a good relationship with the community. When you enter a household, like when you have visited a household in the community, greet the caregiver politely to build and create caring environment. Listen carefully to what the caregiver tells you. This will show him or her that you are taking their concern seriously. Sit close like the caregiver. Speak gently. Remember where you sit and how you speak to the caregiver sets a sense of good communication. Use words that caregiver understand and give their time to ask and answer questions. So, like when you are talking to these caregivers, understand what they are saying. And then after that, you give them time, they ask every question that you have, and then you answer all those questions. And then you gather information through questioning and listening. When you get into the household, you are supposed to ask these members of this household questions. And then when you ask them some simple small questions, you be keen with how they answer these questions. And then what you're supposed to do when you visit the household, you reassure the caregiver, counsel, and share all necessary information. Ensure that you give the caregiver some counsel and guidance, and you share information that is really necessary at the moment, at the particular reason for visiting the household. After the caregiver has welcomed you and you have keenly listened to her health concerns, reassuring and counseling her as necessary, you may now introduce the vaccination topic. So first, let's know what is immunization or vaccination. Immunization is the process whereby a person develops protection from an infectious disease when given a vaccine. Vaccines help to protect the person from infectious diseases, and a person is vaccinated through an injection or drops by mouth. An injection can be either on the thigh, and oral is given through the mouth when you are being given a drop. So some of these diseases protected through immunization, we have tuberculosis. Tuberculosis is caused by a bacteria which usually attacks the lungs, but other parts of the body can also be affected. If not treated properly, TB disease can kill. It can be spread through coughing and sneezing, especially in crowded areas. Symptoms include fever, body weakness, night sweats, night loss, weight, cough, and chest pain. Another thing that we have here, no, I said weight loss, not night loss, weight loss. Another thing under tuberculosis is like, look out for any person with a cough of 2 weeks or more. That is a suspect in tuberculosis. We have another disease called rotavirus. Rotavirus disease is the most common cause of diarrhea disease among children worldwide. Spread by fecal oral routine, by contamination of food, water, and environmental surfaces such as toys. For example, you drink water that is not treated, you may not know whether there was a fecal bacteria that has gotten into that water and you have just taken it, and this can lead to diarrhea. So rotavirus, this is a vaccine given to prevent the disease, in most common cases, diarrhea diseases. And then signs and symptoms, they include vomiting, which usually is followed by watery diarrhea that can last for 3 to 9 days, fever, abdominal pain, nausea, and fatigue. So let's talk about another disease called polio. Poliomyelitis is a disease caused by poliovirus. It is creeping and potentially deadly infectious disease. It can be spread through ingestion, that is introduction of food to the mouth, of infected feces through contaminated food and washed hands. And then the symptoms of this polio is like, you include sore throat, fever, tenderness, nausea, headache, stomach pain. So what are you supposed to look in the community? Look out for any child less than 15 years of age with a sudden onset of weakness of the lymph node due to injury. We have whooping cough as a disease. It is a highly contagious respiratory tract disease that affects people of all ages. It cuts across of all ages. Either you are 20, either you are 15, either you are 2, either you are 3. And then it is spread by droplets from one person to another. It is most dangerous in infants. These are now toddlers, like not even toddlers, those children that are born and then they are young, very, very young, like 1 week. They are characterized by uncontrolling running nose, and then we have long lasting cough, commonly at night, which often makes it hard to breathe. And then, after fits of many cough, one often needs to take a deep breath, which results in whooping sound. Another disease that we want to talk here is diphtheria. The bacteria causes a thick covering in the back of the throat and ulcers in the skin. It can lead to difficult in breathing, heart failure, paralysis, and even death. Symptoms they include bald neck and respiratory obstruction. It is spread in droplets and secretion and secretion from one nose, throat, and eyes in the infected person. Let's talk about tetanus. It's spread by a bacteria present in the soil and fecal waste of animal and human, not transmitted from one person to person, but through wound contaminated with dirt during the ashes containing the bacteria and in the umbilicus following the non-sterilized delivery. Symptoms they are like muscular stiffness in the jaw, stiffness in the neck, difficulty swallowing, stiffness in the stomach, back muscles, we have muscular spasms, and then we have triad by slight irritation like your nose, and then check muscle pulling outwards, sweating, and fever. While you are in the community, look out for any newborn who is normal at birth, then between 2 days and 1 month is unable to breastfeed or has stiffness. And then another disease that I want us to talk here is Haemophilus influenza type B. Haemophilus influenza type B is a bacterial infection which normally causes meningitis and bacterial pneumonia in children. Meningitis is an infection of the brain and spinal cord leading to brain damage and deafness. HIB, that is now Haemophilus type B, disease can be caused severe swelling in the throat, making it hard to breathe, blood infection, joint bones covering of the heart, and even can lead to death. It's transmitted from person to person through droplets and also when children share toys and other things that they put in their mouths. Risk of transmission increase when children spend a long period of time in crowded households and daycare settings. Another disease that we are going to talk here is rubella. It is an acute contagious viral infection caused by rubella virus. It can be spread through airborne droplets. Signs and symptoms include rash, fever, nausea, and mild conjunctivitis, that is. And then another thing we have is pneumococcal disease. Pneumococcal is the most common cause of severe pneumonia, which affects the lungs. Symptoms include fever and chills, cough, rapid breathing or difficulty in breathing, and chest pain. It's spread through droplets and sneezing or cough. Another disease that I want to talk here is vitamin A supplement. Vitamin A supplement is important for boosting the immune system and for healthy growth and development of children. Let's talk about measles. Measles is one of the diseases protected through immunization. It's an acute viral infection caused by measles virus. Highly contagious virus that spreads through the air through coughing and sneezing by the infected person. Starts with fever, running nose, cough, red eyes, and sour throat, followed by rash that spreads over the body. Transmission occurs mainly in crowded homes, and urban slums areas and congested places. Look out for any person with high body temperature, and a rash when you are in the community. Another disease that is being protected through immunization is hepatitis B. Remember the first one that we said it was Haemophilus influenza type B. Now I've remembered about hepatitis B. Hepatitis B is a serious liver infection caused by hepatitis B virus that is easily preventable by a vaccine. Symptoms of acute hepatitis B include fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, and then we have clay colored stool, and then joint pain and judens. Judens is now the yellow color in the skin or the eyes. Another thing that I want to tell you about disease protection through immunization is HPV. HPV in full is human papilloma virus, and the target to all 10-year-old girls. HPV vaccine is a two-dose schedule administered 6 months apart. The vaccine is offered in all public health facilities countrywide at no cost. HPV vaccine is most effective in the prevention of cervical cancer. If your child delays in immunization, visit the health facility to complete the schedule. We have a vaccine for malaria. Malaria is dangerous and can kill. Malaria vaccine is part of the package for malaria prevention alongside other interventions. The vaccine is given 6 months, 7 months, 9 months, and 24 months. Children should get all 4 injections for most protection. Malaria vaccine is currently being administered in 8 counties. In some select sub-counties with a high burden of malaria, that is like Siaya, Kisumu, Homa Bay, Migori, Kakamega, Vihiga, Bungoma, and Busia. If your child delays in immunization, visit a health facility to complete the schedule. Let's talk about new vaccines to be introduced. This is meningococcal A vaccine, typhoid vaccine, and cholera vaccine. So how many vaccines have we talked about? We have talked about tuberculosis, we have talked about polio, diphtheria, whooping cough, tetanus, rotavirus, Haemophilus influenza type B, Haemophilus, and then hepatitis B, pneumococcal disease, measles, rubella, yellow fever, and then we have vitamin A supplement, HPV vaccine, malaria vaccine, and those others that will be added like meningitis, like meningococcal A vaccine, typhoid vaccine, and cholera vaccine. So those vaccines, they are around 12 vaccines that I've said. So let's go and we talk about the target groups of routine immunization. So when we talk about the target group for routine immunization, these are children of the age of 0 to 5 years. 10-year-old adolescent girl, pregnant women, women of reproductive age from 15 to 19 to 49 years. So we have newborn, toddlers, 5-year-old, 10-year-old girl, pregnant women, women of reproductive age. As you can see, this thing is going from childhood up to the adulthood. This now it changes from when we reach at 5 years and above. You see, we shift from boys to girls. Like we focus mostly on girls. So we newborn, this may be either a she or a he. Toddler, still a she or a he. 5-year-old, either a she or a he. But when we get at 10-year-old, these are now girls. Pregnant women, that is pregnant women, and then lastly women of reproductive age. Why do we continue at 10 years old? Remember when I talked about HPV vaccine, we said that you have to continue this for girls that are 10 years old and above, and then you continue pregnant. There are so many changes when we talk about female. And the vaccine safety. What is the safety of these vaccines that are being given? Vaccines used for immunization in Kenya are safe. However, it is important to report any side effect to the nearest facility. Common side effects of vaccine, they include fever, injection site irritation, that's like when you are being injected either in the thigh or ear, that the pain will be, there will be some pain, swelling or redness of that place that you have been injected. If the side effects are of concern, please, and I repeat this, please refer the caregiver to the nearest health facility. Sorry. What to do when caregivers are reluctant and forgetting the vaccine? This is what to do when caregivers are reluctant to getting vaccines. First, do not dismiss, despite, or be rude. So do not dismiss, despise, or be rude. Find out what the caregiver know about vaccines. The third thing, do not debate or argue. Focus on their concern. That is the perfect thing. So don't argue with them. Just focus on their concern. Explore reasons for reluctance with a goal of influencing positive attitude on immunization and behavior. Share information on vaccine benefit or importance of immunization. And then you create time for any discussion. And then after that, you explain the consequences of not accepting vaccination. And then you refer to another health professional for more information. Like, remember the benefit of this immunization is like what we said. It is used to we say that vaccine, they help to protect the person. So if you are not vaccinated, you are not protected against this disease. So you will easily get this disease because you don't have a protection in your body, and the person will be vaccinated either through injection or droplets by mouth. And this is the immunization schedule. At birth or before 2 weeks, you will be given BCG vaccine. 6 weeks, that is 11 to 2 months or soon after, you will be given oral polio. You will be given oral polio. And then at 10 weeks, that is at 10 weeks, you will be given again polio. And then at the age of 14 weeks, you will be given another polio. And then at the age of at birth, you will be given BCG and oral polio. 6 weeks, you will be given oral polio and DPT, hepatitis B, and HIV. And at 10 weeks, you will be given oral polio. You will be given hepatitis B, DPT, that is diphtheria, tetanus, and hepatitis. And then 14 weeks, you will given oral polio. You will be given DPT, hepatitis B, and HIV. And then you will be given PCV, that is for pneumonia 10. And then at the age at 6 months, no, before we go to 6 months, at 14 weeks, you will also be given this vaccine called IPV. And again, at the age of 14 weeks, you will be given vitamin A. 6 months, you will go for measles rubella vaccine. That is at 6 months. Yeah, at 6 months. And then at 9 months. At 9 months, that's where you will be given measles rubella vaccine. And again at 9 months, you will be given yellow fever. And at 6 months, you will be given malaria vaccine. At 7 months, you will be given malaria vaccine. And at 9 months, you will be given malaria vaccine. 18 months, you will be given measles rubella vaccine. And at 24 months, the child will be given malaria vaccine again. And at 10 months, the child will go for human papilloma virus if she is a lady. So that is the immunization schedule. Immunization schedule, we have oral polio, we have rotavirus, measles, rubella. So let me start with this. The first injection is BCG vaccine, which is given at birth through an injection. And then it will be followed by the oral polio vaccine, which is given through the mouth. And then we have diphtheria, pertussis, tetanus, hepatitis B, and Haemophilus influenza type B, which is being given through injection at the teeth. And then after that, we have pneumococcal vaccine given at the teeth. After that, we have measles rubella, 9 months and 18 months. And then we have it's being given here at the muscles, and then we the muscle of the upper limb. And then we have yellow fever vaccine, which is given at 9 months through injection. And then we have this called rotavirus. It's given through a drop or a drop through the mouth. And then you go for the IPV. IPV vaccine is given at the teeth through injection. Yeah, through injection. So when you are assessing the child for immunization status, please check for immunization status in the mother and child health booklet on page 32, current immunization schedule in Kenya. Please check on the immunization status of mother and child booklet on page 32, current immunization schedule in Kenya. So let's go straight to this other part that we're going to talk about, role of community health promoter or mobilizers in the community. Number one, there are 4 main roles of community health promoters or mobilizers in immunization uptake. Number one, you have to educate, screen, refer, and report. Let's talk about educate. Educate and sensitize communities and caregivers on importance of vaccination, safety of vaccine, immunization schedule, and where to get vaccination service. When you do education, mobilize pregnant women to attend antenatal clinic and antenatal clinics at the health facility, that is. And then the third thing, when you educate, help caregivers to understand the immunization schedule and the importance of following and completing the schedule strictly. Emphasize on the importance of using mother and child booklet. Educate the caregivers. So when we talk about caregivers, these are now those people who are in the community, like mothers who are taking care of their young kids. They are caregivers. Another thing that you are supposed to educate them is be a role model or a role model of good health behavior and practices in uptake of immunization services and other health seeking behaviors. Another thing you're supposed to educate them is inform caregiver of advantage of completing immunization, and visit caregivers families who have newborns and children under 5 years of age to encourage them to start or continue vaccine. Let's go to another point, the second one, which is screening. Identify signs and symptoms of vaccine preventable disease. Ensure every child is up to date with their immunization schedule by referring to their mother and child health booklet. Another thing you're supposed to advise on future immunization, including planned immunization campaigns. That's what you're supposed to do when you're doing screening. And then when you talk about referral, this we use an MOH 100. This is a form that is being filled when you are referring a client from the community to the facility. You fill this form. You identify and refer children who are due for vaccination. If the child is sick, refer the child for treatment and immunization due. And then another thing, you identify those children with side effects following immunization that are a concern to the mother caregiver, to the mother who is a caregiver, and refer to the nearest facility. So when we talk about MOH 100, this is a referral form, a form that a community health promoter has at the community. And when you're being given this referral form, when you fill it, when you want to refer the client to the facility, ensure that you have 3 copies. After filling the first copy, you remain with it and you give the caregiver 2 copies. The caregiver will go to the facility, and in the facility, the caregiver will hand over the two copies. 1 copy will be signed by the person who has received the caregiver in the facility. And then after signing all and written all the medication taken, the caregiver will be given one MOH 100 script. He will come back with it, and then the other one will remain in the facility. So when we talk about reporting, this is now collect and keep data and information on immunization status of children in the household you serve. Under reporting, report to the community health assistant. These are now CHAS, or community health officers or community health extension worker, on the activities they have been involved in and any specific health immunization success and challenges they may have encountered that need to be brought to the attention of the high level of health authority. So when we talk about the community health assistants, these are the people that the community health promoters report their grievances to, or in case of any issues, or the community health extension workers, they lead these people, the community health promoters. You're supposed to liaise with the designated health facility to assist in defaulter tracing of children who have missed their due drop doses. When we talk about defaulter tracing, these are people who started taking medication or vaccines, but in between their process they stopped because of many challenges. The reason may be distance, poverty, and many other, maybe drunkenness or family issues. So these are some of the frequently asked questions on immunization. What are the benefits of immunization? Immunization, it protects one from vaccine preventable disease and saves lives. Another question that is commonly asked: who can benefit from vaccine? Vaccination are given to all persons. However, most vaccines are given to children since their immunity is weak and therefore they are at the higher risk of contracting these diseases. Are vaccines given safe? All vaccines are tested by the government authorities. They are safe and effective. Is vaccination safe when one is sick or taking medication? It is safe and important to vaccine sick and disabled children unless advised otherwise by the qualified health worker. What are the dangers when one gets vaccinated? There are no danger in getting vaccinated. Another question that was being asked when we were in the community is that what are the risks of not getting immunization? A person who is not fully immunized is more likely to suffer illness, become permanently disabled, or even die for vaccination preventable disease. Often, a person who is not vaccinated puts other people around him or her at risk. So it's important to get vaccinated. The question that I was asked, it was like, where can I get vaccination service? Vaccination service are offered free of charge in all public health facilities. Visit the nearest public health facility in your place and you will get vaccinated. Can getting multiple vaccine at the same time affect a person's health? No. Injection given at the same time are safe and a person is only exposed to injection pain. And then another question, the last question that I can remember, it was asked in the committee, was like, if my child misses out on vaccination, does he start the vaccine all over again? Children should receive vaccination as recommended in the immunization schedule. However, Should they miss, consult a health worker at the nearest facility. Take vaccines in time to ensure maximum protection. So let me give you some of the 10 key messages to community health promoters or mobilizers. Number one, ensure children are vaccinated at the right age and timely. The second one, vaccination is vaccination is a community responsibility. Screening every child less than 5 years for vaccination status. The third thing, every individual has the right to healthcare, especially immunization, and the service is offered free of charge. The fourth thing to community health promoters, all children less than 5 years need to be protected from infections and may interfere with their growth and development. So that is like this. Let me phrase it well. Children less than 5 years need to be protected from infections that may interfere with their growth and development. The fifth thing, mother and child health handbook is an important document that must be kept safely to monitor growth, immunization, and other services to the children. So ensure that mother and child health booklet is very important, paramount, in fact, every caregiver should have. Lastly, caregiver also need to know that it is safe to immunize the children even if the child is an illness or disability or is suffering from anything. So caregivers also need to know that it is safe to immunize the child even if the child has an illness or a disability or is suffering from anything. So that is all about a guide for community health promoters or mobilizers, or community health promoters and mobilizers. This immunization routine, it will help you. Ensure that you subscribe this channel if it's your first time. You share and then you comment in the comment section site. Give a feedback so that we can know where are we supposed to make a step for a change. Thank you and bye bye.